Do you snore? Does your partner complain about it? Do you wake up tired, groggy, or with a dry mouth, even after a full night's sleep? If the answer is yes, you're not alone. Millions of people around the world suffer from snoring. For some, it's just a loud annoyance. For others, it's a red flag, a sign of disrupted sleep or something more serious happening behind the scenes. But what if you could fix it? Not with gimmicks. Not with uncomfortable machines or surgery, but with a simple device that you wear at night. Something scientifically proven to stop snoring at the source. Welcome to Clover Cure, your trusted channel for practical, proven solutions for better health. Today, we're diving into a game-changing remedy for snoring, mandibular advancement devices, or MADs. By the end of this video, you'll understand exactly how these devices work, why they're so effective, and how they might just be the key to stopping your snoring forever. Let's begin with the basics. Why do people snore in the first place? Snoring occurs when the airflow through your nose and throat becomes partially blocked during sleep. As air struggles to pass through, it causes the surrounding tissues, like the soft palate and uvula, to vibrate. That's what produces the familiar rumbling or rattling sound of snoring. There are many factors that contribute to this. Relaxation of throat muscles during sleep, obesity or excess tissue around the neck, sleeping on your back, nasal congestion, alcohol use before bed, anatomical features like a narrow airway or a large tongue. For many people, snoring is simply noisy and disruptive. But in some cases, it's more than that. It's a warning sign for a sleep disorder called obstructive sleep apnea. Let's talk about that for a moment, because it's important. Obstructive sleep apnea is a condition where your airway becomes partially or completely blocked during sleep. When this happens, your breathing either slows down significantly or stops altogether for short periods. These events are called apneas and hyponias. An apnea is a full pause in breathing that lasts at least 10 seconds. A hyponia is a partial blockage where airflow is reduced by at least 30%, also for 10 seconds or more, often accompanied by a drop in blood oxygen levels. When apneas and hyponias occur frequently throughout the night, your body is forced to wake up, often just slightly, to reopen the airway. This disrupts the natural sleep cycle, especially the deep and REM stages that are essential for physical and mental restoration. People with untreated sleep apnea often feel exhausted during the day, no matter how long they've slept. They may also suffer from memory problems, mood swings, difficulty concentrating, and even high blood pressure or heart disease. So yes, snoring can be a warning sign of something much more serious. Now that you understand the problem, let's talk about the solution. The mandibular advancement device, or MAD, is a mouthpiece that you wear while you sleep. It resembles a sports mouthguard or dental retainer, but it does something remarkable. It gently pulls your lower jaw forward, just slightly, maybe a few millimeters. This small movement helps open the airway by moving the tongue and other soft tissues away from the back of the throat. Why does that matter? Because by moving the jaw forward, the MAD helps prevent the collapse or narrowing of the upper airway. That means air flows freely, tissues don't vibrate, and snoring is dramatically reduced or eliminated. And here's the part that's even more important for people with mild to moderate sleep apnea. A MAD can reduce the number of apneas and hyponias per hour. This measurement is called the apnea-hyponia index, or AHI. It's the number of times per hour that your breathing is significantly disrupted while you sleep. For example, an AHI of less than 5 is considered normal. 5 to 15 is mild sleep apnea. 15 to 30 is moderate. And above 30 is severe. Clinical studies have shown that using a MAD can reduce the AHI score significantly in people with mild to moderate cases, sometimes by more than 50%. That means better sleep quality, improved oxygen levels, and reduced strain on the heart and brain. In short, MADs don't just stop the noise. They may help protect your long-term health. So, how do you get one? There are two main options. Option 1 is the over-the-counter MAD. These are typically boil and bite devices that you soften in hot water and mold to the shape of your mouth. They cost anywhere from $40 to $100 and are widely available online or at pharmacies. They're a great starting point if you want to test whether this approach works for you. Option 2 is the custom-fitted MAD, prescribed by a dentist or sleep specialist. These are built specifically for your jaw and bite. They tend to be more comfortable, more durable, and more effective, especially for long-term use or more complex cases. These custom devices can cost upwards of $1,000, but they may be covered by insurance if you've been diagnosed with sleep apnea. So, what's it like to wear one? Most users say that it takes a few nights to adjust. Some report mild jaw soreness, increased saliva, or dry mouth at first. But these symptoms usually fade quickly. Once you adapt, putting it in becomes second nature, like brushing your teeth before bed. The results can be life-changing. Imagine falling asleep peacefully, staying asleep all night, waking up refreshed, and hearing your partner say, "You didn't snore at all last night." That's not just possible, it's common. Now, let's talk about some tips for success with the MAD. Number 1. Wear it consistently. Skipping nights interrupts progress. Make it part of your nightly routine. Number 2. Clean it daily. Rinse it with water and use a toothbrush or specialized cleaning tablet. Keeping it clean prevents bacteria buildup and keeps it comfortable. Number 3. Combine it with other good habits. Lose weight if you're overweight. Avoid alcohol and sedatives before bed. Manage allergies and nasal congestion. And try sleeping on your side to keep the airway open. Number 4. Track your progress. There are smartphone apps and smartwatches that can detect snoring volume and frequency. These can help you monitor how effective the MAD is over time. Number 5. Consult a professional if needed. If your symptoms are severe, or if the MAD doesn't seem to help, speak with a doctor. A sleep study can reveal whether you need further intervention, such as CPAP therapy or another treatment. Now, some people wonder whether a MAD is better than a CPAP machine. The answer? It depends. CPAP, which stands for Continuous Positive Airway Pressure, is considered the gold standard for treating moderate to severe sleep apnea. It works by delivering pressurized air through a mask to keep the airway open. But CPAP machines can be uncomfortable, noisy, and difficult to travel with. Many patients stop using them because of the inconvenience. MADs offer a low-maintenance, silent, and portable alternative for those who can't tolerate CPAP or don't need it. For people with primary snoring or mild sleep apnea, MADs are often just as effective and far easier to use. You simply don't have to live with a snoring problem. Don't sleep on snoring. You now know that snoring is often caused by narrowed or collapsing airways during sleep. Mandibular advancement devices address this by gently moving the lower jaw forward, opening up the airway, and reducing both snoring and breathing disruptions. They're easy to use, backed by science, and available in both affordable over-the-counter and high-quality custom options. With regular use, many people experience better sleep, improved health, and quieter nights, sometimes within the very first week. If you or someone you love snores regularly, a MAD may be the simple solution you've been looking for. No noise, no interruptions, just sleep. Thank you for watching Clover Cure. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs better rest. We're here to bring you the best in natural health, smart science, and real results. Until next time, sleep well, breathe easy, and take care.